All right, so let's get started. Hi, everyone, and welcome to the Black AIDS Institute's Brown Bag Lunch series. We are extremely excited that you're able to tune in today. My name is Tanisha Lewis. I use she, her pronouns, and I'm BAI's Senior Manager of Training and Capacity Building. BAI's mission is to stop the AIDS epidemic in Black communities by engaging and mobilizing Black institutions and individuals to confront HIV. So we advance this mission with activities like our brown bag lunches. And every single month, we're bringing in folks who can speak to HIV related issues facing Black Americans. This month, we are highlighting the most recent data on the impact of HIV on the South, particularly regarding Black communities. So today, I'm happy to introduce a key figure in the Southern AIDS Coalition, Dafina Ward, Executive Director. So Dafina brings more than a dozen years of experience leading community-focused HIV programs in the Southern United States, and she's committed to ending siloed approaches to transformation and regional healing. Based in coastal South Carolina, she's been with the Southern AIDS Coalition since 2018 and has served as executive director since December of 2020. So what we're going to do now is we're going to turn the session over to her expertise to share some words about SAC's work and the importance of prioritizing the work in Black communities. And then we're going to have a Q&A period. So please feel free at any point in time to ask questions. For those who are in Zoom, you can do so using our Q&A feature. And if you hover over the bottom of your Zoom screen, you'll see a Q&A button. You can also do so in the chat, though where it's preferred that you use that Q&A button, okay? And we'll have time to address your questions following the presentation. So we're going to go ahead and turn it over. Welcome, Dafina.
Thank you so much, Tanisha, and thank you everyone for coming. I'm Dafina Ward. Pronouns are she, her, hers, and I have the honor of serving as Executive Director of the Southern AIDS Coalition. And I'm just so appreciative to be here today. We count BAI as one of our most important partners in this fight and have for years. And so we're just really thrilled to have this chance to talk with you all today. I'm not sure how familiar you are with the Southern AIDS Coalition, or SAC, as we're called in our work. But we're an organization that started in 2001 with a focus on making sure that federal resources were getting to Southern communities. We recognized that there was, at that time, an inequitable distribution of resources. And while we were seeing the development and the budding of a Southern HIV epidemic, the dollars were not matching up with the need. And that's really, SAC was birthed out of that. Birthed out of the need to effectively address what was happening or beginning to happen with HIV in the South, led by advocates who were on the ground, leaders of community-based organizations, grassroots advocates, state HIV/AIDS directors, and other public health folks who decided that we needed to have a voice and united to be just that at the federal level. And over the past 20 years, we've evolved. Our vision has not changed. Our work has changed a bit, but we're an organization that is truly about centering the community, amplifying the community voice and experience, and working in collaboration with all of you. And we truly believe that ending the Southern HIV epidemic is very necessary if we're going to truly end the national HIV epidemic. So on last Friday, August 20th, we commemorated the third annual Southern HIV/AIDS Awareness Day. Hopefully you saw that on your social media or heard some conversations about the day, but it's an awareness day that SAC launched in 2019, recognizing the need for a focus and intentional focus on HIV in Southern communities. And while it is a regional name for our Awareness Day, it is very much a national need of focus. And so we partnered with organizations all over, and organizations really took on the mantle of lifting up Southern HIV/AIDS Awareness Day. And as part of our Awareness Day last week, we released a new trends report that speaks to the most current data through 2019 on the impact of HIV on the Deep South particularly. So really excited to have this opportunity to talk with you all today in commemoration and acknowledgement of SHAD this month, and just so we can continue to have these conversations at a national level about why everyone should care and be engaged around what's happening in the Southern United States. Everywhere I go, I bring my people with me. And this is my team. This is the Southern AIDS Coalition staff. And we are just so excited to work and partner with so many of you in so many different ways. Our work now, in addition to our work around policy advocacy, we also do leadership development for persons who are living with and impacted by HIV, training and capacity building with community-based organizations, as well as public health and jurisdictions, research, and really data translation is what we hope to do in a way that we can take data and work in collaboration with our research partners to push it out into the community in a way that is useful to you and your work and your own advocacy and your own teaching and education in your community, and communications and convening. We like to get the people together and talk and have conversations. We are a Gilead Compass Initiative Coordinating Center, so we provide grant making in that vein as well. And these are the values that we hold true to at SAC, and as part of our role as a coordinating center, doing grant making and partnering with organizations in the 12 Southern states. We are also a TA provider under the EHE and work in collaboration with the Technical Assistant Provider Innovation Network, or TAP-IN, as well as NASTAD, where we are really focused and honing in on systems coordination and de-siloing approaches to addressing HIV, particularly in Southern jurisdictions. All right, so I had got my commercial out of the way and wanted to share with you a bit about who we are as an organization. And now I want to talk about HIV in the South. And anytime I begin this conversation, recently I've had to start with this map. And what you see here is a map that was developed by the NAACP, capturing the impact of racist, violent lynching in the United States over a 10-year period. And I appreciate looking at this map, because when you layer this map and you begin to look at the disparities in HIV, in health, in all of the different ways that people live, and we start talking about social determinants, I feel like all of that is inextricably linked to what we've seen happen historically in this country when it comes to the assault on the very humanity of Black people. And so if we're gonna have conversations around HIV, we really have to dial it back and get in this time machine and go back to this lynching period in the early 1900s, and even before that. We were talking about chattel slavery and enslavement here in the United States, and the range of other atrocities and wrongs that have resulted to what we're dealing with now when we're talking about health disparities and why particular communities are most impacted by HIV. And as you can see here, I'm going to show you a couple of maps. And this map, as you can see, the darkest areas are those areas where you have the greatest number of lynchings that were actually documented. And we know that there were many, many, many lynchings that were not documented. So as you go from darkest to lightest, darkest being the most numbers of documented lynchings in the 10-year period in the early 1900s, and then you'll see them shaded in and getting lighter and lighter, and you'll see the Deep South is undeniably most heavily laden with the history of lynching and racist violence. And so I say all of that to say that the fight for equality and civil and human rights, particularly in the South, is connected very much so to the fight for health equity and this demand that we're making that social determinants be effectively addressed and the community voices be heard so that we can end the HIV epidemic, and that we can't do that until we acknowledge the systemic racism and the range of barriers that communities have been oppressed and dealing with over centuries, and particularly as we're talking about the 40 years of the HIV epidemic in this country, how it has come to be an epidemic that primarily sits on the shoulders of Black and Brown communities, and very heavily in the South. I would also be remiss if we didn't talk about this in the context of Medicaid expansion, recognizing here that most Southern states have not expanded Medicaid. And while it is not the end all be all around someone accessing care, the data is telling us that in those states where Medicaid has been expanded, people are more likely to know their HIV status and therefore more likely to be engaged in HIV care. And I'm sure there's a number of other data points around Medicaid expansion that we could lift up to talk about access to effective health care, routine screenings, preventive care, and all of these other things that are tied to one, having access to free, low, no cost healthcare. And so if we're going to have conversations around HIV, we have to continue to look to what are some of these policy issues that are resulting in particular communities being inequitably impacted by the HIV epidemic. We also have to look at where education is happening and not happening. As we talk about stigma, as we talk about prevention, we have to have those conversations within the context of what's happening in education. And so in many Southern states, as in other states, there may be limited sex education. And if sex education is mandatory, it may or may not include HIV specific education. And in most Southern states, as you can see, there's going to be stress around abstinence. So you're not going to talk about comprehensive sexual health in schools, and thus resulting in a range of misinformation and lack of information and knowledge, a lack of understanding even around, at times, around sexual consent, around how HIV and other STIs are transmitted. And often in those settings, I have two girls who are in high school and middle school and in these classes, and talking about the fact that they talk about what the boys might need or what they'll experience, but don't talk about what the girls or non-binary folks might experience and the range of gender identity that might be present in these classrooms. And so the continued othering or ignoring of the needs of many of our young people in these educational spaces. Also having to recognize that in many Southern states, as in many states across this country, that there is a lack of protections for LGBTQ plus folks. And so you're talking about the layers of a history of racial violence, lack of education, lack of Medicaid expansion in many states in the region, and then a lack of protections for folks who may be LGBTQ plus as well. And so all of that is very much connected, and we could continue to layer things on top of that. If we wanted to talk about barriers to the ballot box, if we wanted to talk about criminalization of HIV, we could continue to layer and see where these things are most prevalent, very much so in many Southern states. This particular slide here is an example from a study that was done through the Compass Initiative, where we were looking at driving times to stigma reduction services. And so what you see here is nearly 40,000 people living with HIV in the South are living in a service desert when it comes to services that are addressing stigma. And we know that stigma is rampant, and particularly so in the Deep South, the South in general, but particularly the US Deep South. And the fact that services that may combat stigma, that may provide support, that may get someone out of isolation, are very difficult to reach for tens of thousands of folks in the South. And while we don't have a breakdown around race, where this, as it pertains to this particular study, we do know that most people living with HIV in the South are Black folks. And so we know that Black people are being greatly impacted by this. And again, layering on top of that, challenges around transportation, lack of public transportation in many communities, definitely so in rural communities, and just an inability to get to services that could provide some relief, that could provide some resources and support, is particularly difficult in the Deep South states. So today, GLAAD released their update to their State of HIV Stigma study, which initially came out in 2020. And this year they released it with a Southern focus, because it's really important for us to look to the way that stigma, the way that a lack of information, misinformation, and fear are driving HIV in Southern communities, of course, across the country, but particularly in Southern communities. And if you look here, one of the differences, and it's not a huge difference, but in the South, and we're tied with the Midwest here, when they looked at non-LGBTQ respondents, there was a stated discomfort around medical professionals living with HIV providing care. And this is just an example of folks not understanding how HIV is transmitted and the need we have to make sure that folks are better educated about HIV. The fact that more than half of respondents express discomfort around any medical professional providing services to them living with HIV. and just this general discomfort around people living with HIV, this false notion that somehow HIV is transmitted through interpersonal communication or a simple touch, and not understanding how HIV is transmitted results in just discomfort around people living with HIV, going about their everyday lives providing services. And so this is definitely something that needs to be combated. And I think if we reflect specifically on our experiences in Black communities, we know the importance of particularly thinking about hairstylists and barbers and those places as being where we talk about so much when it comes to relationships and sex and all of that. And it can be a breeding ground for misinformation, or it can be a space for sharing accurate information that can combat the type of stigma that we're dealing with now. So I do want to share a bit of data with you all from the trends report that was released last week as part of the Southern HIV/AIDS Awareness Day. And I will preface all of this by saying I am not the researcher. I am here sharing with you some of this data, and we will also share a link with you all after this meeting, so that you can have an opportunity to dig down and really get into the weeds with this information. And in the next couple of weeks, we'll be having an actual talk back with the researchers around this data. So be on the lookout for information about that, because we definitely want to have folks really utilize this report as a resource. So the trends report has been updated now through 2019. That's the most up-to-date and complete set of data that's available. Previously, the trends report had been updated through 2016. So we're really excited to have this update available for people to use in their advocacy work, in their grant writing, just in conversation and in your planning around, as you're thinking about how this looks in your particular work, how this applies particularly to Black communities, and what we can do to combat some of these challenges. Just to set the stage, this report specifically deals with the Deep South, which are those states that are in red, right? Now, of course, the South in itself has its own issues, the South in general, but the Deep South states tend to have a particular history, culture, and trends, and very much align them with one another. So there will be some additional data that we're putting out around some other states, including Virginia and Arkansas. But it's also important, we think, to really focus in on the Deep South states, because we know that's where we are seeing the greatest rates of HIV and the greatest prevalence in the South. So this is just an example. We've seen some decrease of diagnosis rates in the South. Yet the Deep South tends to still be very much above all of the other regions in the nation. And you see where we sit, the Black dotted line representing the rates, the total US average rates. And you see the distinction and comparison of what's happening in the Deep South and the Southern US. So there is still demonstrated, even up to through 2019, we're still seeing, though there is a decrease, still seeing significantly higher numbers than other regions in the country. And this here just to demonstrate what Deep South states are dealing with, as you're looking at just the general in the middle, just kind of the average of Deep South states. And then at the top, you can see those states that have the greatest rates, including Florida, Georgia, and Louisiana. And in comparison, when you look at these states individually and then compare it to where we're sitting, when you look at it region by region, you see that we're still dealing with rates that are far higher than many of the other regions at large, even when you're breaking it down state by state. Now, this one is particularly interesting, and we've known this to be true. We are continuing to see significantly higher rates among Blacks than we are seeing in other communities. And we know this is a national demonstration of that. And we are continuing to see, while there is some decrease, it is still significantly higher than any other race or ethnicity. And the same is true when it comes to looking at, I apologize, I didn't include the slide on race by region, but the numbers continue to be true when you're looking at race and ethnicity, specifically among African Americans in the South, still significantly higher than any other group in the region. There has been some increase among Latinx men in the South, but still not meeting the level of where we're seeing rates among Black same gender loving men or men who have sex with men in the South. So this is just also another demonstration of where we're seeing transmission happen in the South, and still very much so. We're seeing the highest rates reported as male-to-male sexual contact, followed by heterosexual sexual contact, and then far beneath that, we're seeing injection drug use and other contact and injection drug use and other as well. And so some of the conversation we have to continue to have is, while there's been such a significant investment of resources in addressing HIV among men who have sex with men or same gender loving men, particularly Black and brown men, why are we continuing to see these high rates? And that's when we have to really start having conversations around stigma, around how people are accessing services, whether services are accessible, and how we ensure that folks have access to services that are affirming and not stigmatizing. And I'll share a story just as an example of a challenge that we've seen. I recently met with the director of a Southern rape crisis network, one of the Southern states. And we were talking about the challenge of making sure that men who are reporting sexual assault and rape are getting the services and care that they need. There was a sexual assault nurse in a Southern state who was assigned to perform a rape kit and provide support and counseling to a man who reported being sexually assaulted, and she refused to provide him services. She refused to provide him services because she said she didn't believe in that. And this is the type of challenge that we're dealing with. Will that man ever access healthcare services again? How much harm was done in that interaction where she was supposed to be a trusting resource after he was brave enough to come forward and seek help after being violated, and to be turned away and discriminated against in such a horrific way. And when we talk about why the rates look this way, these are the conversations that we have to have. We've also seen decline in age groups, with the exception of with the 25 to 34-year-olds still being the highest number, or the highest rates that we're seeing. And so that in itself is that we're really excited to see the numbers going down among young folks, but what's happening in that 25 to 34 range and what needs to be done to address that. We know that that's also an age group that just typically does not engage in health care. It may not have access to resources to have comprehensive insurance coverage, and therefore may not just be engaged in general health care. And there's an opportunity then, how do we better utilize our emergency departments, our urgent care centers, to share information around HIV testing, around PrEP and PEP, and to engage people when we have them, when they come in for that one thing that they need care about, to make sure that we're providing a comprehensive picture of health and wellness and what they need to be focused on to take care of themselves. We know that many providers are not having conversations around sex, that there are a lot of presumptions and assumptions made around who needs to be engaged in HIV testing and who doesn't. I've had several people talk to me about having to beg their doctor to talk with them about PrEP, having to beg their doctor for an HIV test because they were convinced, their provider was convinced that they weren't someone who needed to be worried about that. So how do we create care settings where people are getting what they need and able to have these conversations without judgment and without having to beg for the resources that they know they need? And so there's just a lot of work to do there, particularly with all people, but particularly with young adults. So wanted to talk for a moment about PrEP. We know that the PrEP to need ratio in Southern communities is significant. We know that it's significant across the country, but we've seen an uptake through 2019 in the number of folks in the South who are being prescribed PrEP, but we are seeing challenges with retention. And we also know that while there's been an increase in the number of folks who have been prescribed PrEP, it is not at all matching up with the PrEP to need ratio based on the rate of HIV diagnosis that we're seeing in the Southern United States. So that was truly just a snapshot of what we're seeing in this 2019 trends report. And I look forward to having a chance to have some conversation, but just some food for thought as we're thinking about this, specifically in the context of the South, and even more specifically in the context of being Black in the South, that there have been overall declines in HIV diagnosis rates, but it's not been equitable across demographics. Some communities are seeing significant reductions in new HIV infection, while others are not, and particularly in Black and Brown communities. We have to look to what's happening with the consistency of seeing these diagnoses in that 25 to 34 age group, and what it is we need to be doing to better engage young people in conversations around health. That we continue, did not touch on this in the earlier slides, but the Deep South continues to have the highest death rates among people living with HIV. So even though we've had all these breakthroughs in medication and these advances, we're still seeing higher death rates among people living with HIV here in the South. That there is an interconnection between social determinants and policy. And we know this to be true. We know that policy can drive stigma, policy can drive opportunities for improvement and improvements in access. And we know that they say all politics is local. So while we're very much focused on federal policy, we have to recognize that what happens with a person's day-to-day quality of life is even going to be more so tied to their local and state law policy. And so we want people to be engaged in that way. HIV criminalization is pervasive in Southern states. We know that it drives stigma and it does harm. And what do we do to combat that? And we know that states like Virginia, that there have been advocates on the ground doing work there, have made great strides, as we're trying to do in other states across the South. And that South makes up only 27% of PrEP use, despite the fact that we have the highest rates of HIV diagnosis. So this is food for thought and things for us to consider as we're thinking about the shaping of our programs, if we're doing programming, case management work, policy advocacy, that we consider like painting a full picture of the impact of HIV on Black communities and not allowing HIV to sit siloed and alone, because we know that it did not happen in a vacuum, that Black communities are particularly impacted, and that is just a part of a full range of issues, systemic issues, barriers, and policies that must be overcome in order for us to effectively address that. Lastly, for those who are in the South, we are in the process at SAC of compiling data from members of the community. We want the Southern voice to be a part of the update to the National HIV Strategic Plan. The White House Office of National AIDS Policy is working to do an update that reflects the Biden administration's priorities and the office's priorities, and to present that around World AIDS Day. And so we volunteered to compile input from folks who were in the South, who were on the ground doing the work. And this is another link that we can provide as well. So if you're living in the South, or know folks who are, and when we say South, we mean the 16 Southern states and DC, not just the Deep South, we definitely want your voices to be heard in that. And that concludes my comments. Thank you so much.
Wonderful. Thank you so much. Now we're going to open it up for a Q&A session. We've got a few questions, a couple of housekeeping ones first. Folks want to know, will they be able to get a copy of the slides?
Yeah, absolutely. And I'll also put a link to the actual report in the chat, because I know a couple of folks have asked about being able to get the data. And I would love for you all to get the data and be able to chew on it yourself and hear back from you about it.
Wonderful. And I'll go ahead and say, if you'd like that copy, if you need the link, maybe you lose it in chat, or even if you want that copy of the slides, just feel free to email me. For those in Zoom, you can see my email in the chat. And for those watching later on YouTube, my email is TeneshaL, TENESHAL @blackaids.org, which kind of leads me to my next comment, that if anyone wants to take another look at this presentation, you'll have an opportunity in about a week or so. We tend to put up our videos maybe about 7 days after each event. So you can take a look at our YouTube. It's at Black AIDS. And if you have trouble getting there in about a week or so, you can email me there too. All right. So we've got another question, and the question says, under PREA, isn't there a legal requirement for sexual assault to be addressed?
I really don't have an answer to that, Richard. I would have to look into that and would love to have a conversation about that because I'm not certain.
That's a great question.
That's really a good
So
question.
we've got another one here that says, would health ministries and our religious circles be a vehicle to provide sex education to communities, particularly communities of color?
Absolutely. I think that I didn't even touch on the role of faith communities. We hear a lot about, the trauma of engaging in faith spaces and actually hear a lot about some of the harms that folks have encountered. And there's also, I think, hope and opportunity for faith leaders to be involved in these conversations. And first and foremost, it's just a matter of not using your pulpit as a bully pulpit and, further stigmatizing. And I think there's a lot of education that has to happen in church and faith spaces. What we have found to be effective is to identify that one person, to find one person who may be a leader in that congregation, who's willing to have these conversations, who's willing to take it to the church and get leadership's buy-in. I think one of the challenges that we have in this work is that we often want folks to be at 100 from day one. And in working with faith communities, it's so important to recognize that there's a lot of teaching that has to happen along the way. And so we cannot be scared away by having to take those baby steps to do this work in faith spaces. And I don't mean that those who are living with and directly impacted by HIV need to put themselves in the way of further harm, or LGBTQ plus folks who have been harmed in those spaces. But those of us who do this work and want to engage with faith communities need to be prepared for it to be a long haul, and not a quick change in a lot of those spaces.
Great, thank you. So another viewer would like to know, over the next decade, what does SAC see with combating HIV stigma and the informational education on PrEP among the 18 to 30 age group?
That's such a good question. We're focusing our efforts right now on doing a better job of engaging with folks who are in that age group. I think the biggest mistake we make is that we're not talking to people who are in the 18 to 30 age group. We plan for and not with so often in this work. And so that's something that we're working to do. Our staff has currently grown, and many of our staff members are younger and are in these communities. And we think that that's tremendously important. So our first step is to have more conversations with community, particularly young people, around what the barriers are that they're experiencing. Why the survey that we're doing now is so important, because we want to know what those barriers are. One barrier we hear a lot is that folks just can't get to the resources, and they're afraid if they get to the place that provides those resources, that there's stigma attached to that. I don't want to go to an HIV clinic to get PrEP. I don't want to be seen in certain spaces. And we know that that in itself is problematic, but we have to acknowledge that that is the real experience of a lot of people in community. And so how do we create more comprehensive care in community spaces so that people can feel even more comfortable accessing services in their communities? We're also working in collaboration. There's a lot of great work happening with HBCUs, and we think that that's critically important too, is to talk to young people on these college campuses and to engage with them about that, and to also reach young people who are not on these college campuses that may be in other programs where they need to get this information as well. But we know now we have new PrEP guidelines. PrEP is supposed to be no cost, but we know there's a lot of work that's going to have to happen around implementation to make that happen.
Thank you for that. Now, this next question sort of shifts gears a little bit and it's talking about drug misuse. So it says that IV drug use was a quote unquote lesser cause of HIV transmission in the data that you reported, so the data on the slide you showed, and that recent data, however, suggests that the opioid epidemic has been significantly worsened by this COVID pandemic, particularly among Black communities. So, how do you anticipate that this might, quote unquote, change the curve of IV drug use as a cause in Black Americans?
Lauren, that's such a good question. And there's actually a spotlight on COVID in our report. I didn't touch on it just now, just in the interest of time, but we talk about the impact that we're seeing COVID have, not specifically around drug use, but even around the way that folks access services. We know that HIV testing during the pandemic in some places dropped as much as 70%. And so we know that there's going to be significant likely a significant rate of diagnosis as we get out of the pandemic, whatever that looks like, but it's going to take time. What we're hearing from communities is there is a significant increase in the use of opioids and other drugs, specifically in the Black community during COVID. So we are anticipating there's going to be that there will be some increase. We're also recognizing that there needs to be more conversations around how we address those needs, because part of the problem is one, that folks need to be trained on how to provide services and resources and meet needs for people who may be using substances. And if they need Narcan, if they need resources and support, can they get that in their community? Are people on the ground in our communities trained? And if people need a bed, if they desire to get into treatment or need services, is that accessible as well? So I'm anticipating we will see some increase. We don't know what the long haul impact of COVID will be around HIV rates, but we do know that we're seeing an increase in need around treatment and support for substance use, and that we don't have that in many of our communities.
Great, thank you. And so, as a perfect segue into that, still talking about COVID, someone asked, how do you think the current pandemic has affected the efforts to address HIV prevention in the South?
Yeah, it's tough. I mean, what we know is that in many, particularly in public health, folks have been redeployed to address COVID, and so many who were focused on HIV have not been able to do that in the past 18 months. And there were a number of folks who had been placed back into their primary roles in HIV prevention and other key areas of HIV related services who have now been redeployed again to address the Delta variant and the issues with COVID in their communities. So what we know to be true is that outreach could not happen for a significant number of time, that organizations had to focus in very clearly on meeting what they prioritize as immediate needs in their community. So a number of prevention programs have likely suffered and not been able to be as aggressive in the delivery of services. However, what we've also seen is that in many communities, HIV testing is continued in spaces where organizations have pivoted. I know specifically in Alabama of a program where they are now doing, COVID testing in addition to their HIV testing, in addition to their PrEP services, and have been able to continue to do so. But we're going to really have to focus on really identifying what we've missed during COVID and being very aggressive. There's going to need to be a huge influx of resources to address HIV prevention in the South at the intersection of COVID and a range of other challenges that people are facing, be it around the housing crisis, employment, and a range of other mental health. We definitely need to integrate HIV prevention into these other spaces where we know that there's needs that have got to be met as a result of this pandemic. Things that have already existed as challenges that are now further amplified because the inequity that has arisen, and now everyone now knows what a social determinant means. Well, before COVID, folks, I guess a lot of people didn't. We've been doing this work and we've known. So yeah, it's going to be really interesting to see what that looks like when we are able to really get a sense of the gravity of the impact of COVID on HIV prevention efforts.
Wonderful. Thank you for that. So the question that we received around PREA, the person just wanted to provide a little bit of context, and this will be really useful for the folks who are watching later on YouTube as well. So they just wanted to let everyone know, for those who didn't, that it's the Prison Rape Elimination Act, and that they work in corrections and tend to see many sexual assault victims who identify as trans women of color or who identify as gay men, and who come across female inmates who face sexual assault from staff. So just providing a little bit of context for that question.
Thank you for that, Richard.
We also have another comment that's speaking about an amazing program in Oakland, one of the largest churches in the area, and perhaps you could consider using them as a template for other communities throughout the country. And there may be a distinct group or committee among the organizations on these kinds of calls to create training modules and create an outreach program for the faith community. That's great input. Thank you for that.
That is great. And I'd love to lift up, this Sunday is actually National Faith HIV/AIDS Awareness Day. So there's great opportunities to be engaged in conversations around HIV and faith. You could also consider Wake Forest University, their School of Divinity. They have a Faith and HIV Center that is doing great work. And so if anyone is interested in learning about work that is happening, and I'm sure and that program in Oakland sounds like a great example, there are templates and resources and even grants available to organizations that want to truly work at the intersection of faith and HIV.
I love that. Thank you so much. And it makes me very happy to hear you talking about Wake Forest. I went to undergrad at Duke, so Wake, Duke, UNC, all of those, especially the divinity schools that are really close to me. If anyone has any other questions, feel free to ask them in the Q&A. In the meantime, I do have one. Um, so with the U.S. maps you showed a lot of layering, so tons of issues that we've seen. We realize that, wow, there's a lot of work to be done. So the folks on this call and the folks who are tuning in later on YouTube and other avenues obviously want to make a difference. How do we begin to start making an impact on these communities, particularly these communities in the South who've already dealt with so much over the past several hundred years?
Yeah, yeah, that's a really great question, and I don't think there's a simple answer. I think that there are things that we can do on our own individually, like vote, make sure the folks in our lives are registered to vote, support candidates for office who are truly on the side of justice and who are pushing for there to be change in the South. A lot of people say like the South. It's not that our states are that all lean very right or lean a certain way. It's just that the vote here is suppressed, right? And so recognizing efforts to support the vote in Southern states. I'd also say to support organizations that are on the ground doing the work. Part of what we're focusing on is how do we build and sustain emerging organizations, the organizations that are closest, that are led by people who have been directly impacted, that are closest to the communities and hold the trust of the communities most impacted, are really going to change the face of this epidemic in the South. They're the ones who are going to engage the folks who are 18 to 30, who will understand what the needs are of people who may now be using drugs or have come to all types of trauma and challenge during this pandemic. So support those emerging organizations. And I think in addition to that, having conversations and engaging with public health, if there's an opportunity to sit at these tables as policies are being developed, as requests for proposals are being created, how do we make those more accessible? How do we hold these dollars, make them be used in a way that we can hold them more accountable? And how do we hold organizations accountable to the communities that they're charged to serve? And so I think being a voice in all of these spaces is tremendously important, and supporting the work that's happening on the ground. Those are truly key ways. And communicating with our decision makers and lawmakers. We have seen countless bills over the past few months come down that would harm historically marginalized communities, whether that's trying to keep trans young people out of sports, or if it's about suppressing the vote. There's all of these things. It seemed like there was just a coordinated attack that happened after November to truly continue to oppress and create systemic barriers. We have to call that out. And we have to let our decision makers know that we care about all of it. I think there is a presumption so often that as a Black woman, I'm only going to care about things that impact Black women. At the end of the day, all the bad stuff is going to impact Black women, right? But it's like recognizing that we all have a space and we all should use our voices to come to the table when we see these wrongs happening, and not cherry pick when we're going to come into spaces and hold these decision makers accountable.
Thanks for that. And we had a couple more questions come in. So, like I said, folks, if you have something that you'd like to ask, feel free to use the Q&A button. We've got some more time left, so we can definitely get to those. So the next one asks is, how challenging is it to utilize social media methods to promote and implement HIV prevention or testing in the Deep South? For example, at-home testing.
Yeah. I think, it's social media can be such an amazing tool, and we're seeing a lot of Southern organizations use it very well to engage folks, be it in at-home testing, to make sure folks are staying retained and following their medical regimen to make sure that they are getting what they need. And we're seeing a lot of community organizations masterfully utilize social media to do that. I think on the flip side of that, what we're also seeing is that it tends to, we talk a lot about preaching to the choir in this work. And so I think the greater question is even how do we utilize social media, particularly in the South, to get these messages out to more people? And I think this is also about how do we build relationships? How do we build collaboration that is not just HIV focused, so that when we're talking about health and wellness and justice, that we're talking about the value of healthcare, we're talking about at-home testing, we're talking about PrEP and PEP. And so I think so while it is being done and being done well, there is still an opportunity to truly utilize the influence of social media to create greater buy-in. And, what we do know is that there's a lot of misinformation. We've seen what's happened recently with DaBaby and other folks who might say things that influences millions of folks. And whereas, how do we help to utilize social media as a tool for change, and rather than information being untrue and then weaponized to do more harm.
Great, thank you. So we've got a question here that asks, is there outreach being looked at with men who are concurrently incarcerated and HIV testing?
Yeah, I'm sure there is some happening in the region. I know that there is a program happening out of University of Alabama at Birmingham where they are working with county jails to provide the testing and then the necessary linkage and support and retention upon release, retention and care. So I know that there's one program there, and I know someone who's working on that. So if this is something you'd like to be connected to, would be happy to kind of have that conversation, because we know that there are some programs happening, but I don't know of anything coordinated at state levels that speak specifically to this, but that there are organizations, community-based organizations, who are working with individual counties and communities and municipal jails around this issue. But this is definitely another area where there has to be more coordination and where there has to be more buy-in and accountability to make sure that that's happening.
Great. And so this next question is asking, it's revolving around who's doing the work. So, in addition to your organization, and I'll even throw in there BAI, how do we find additional organizations that are doing the work? And if you have some suggestions for that too.
It's so funny because when we talk about doing the work, I think that can often be so subjective, because I tell people what you're doing in your own personal relationships one-on-one, that's the work. When we're not stigmatizing, when you're supporting someone who's living with HIV, or going with a friend to get their HIV test or whatever it is, all of that is doing the work. So I just think it's important to name that, because all of that is also advocacy, right? And so sometimes we make things, we think it has to be more formal than that, but that one-on-one interaction is the work. And if we all did a little bit of that, all of this would be different. But there's a number of organizations. I think it's really great to get involved with planning and advisory groups in your community to learn who's doing the work on the ground in your particular community. Also, I think platforms like this are great. Look for opportunities to participate and engage in not just webinars, but even there's a lot of community conversations happening right now. The federal EHE, or Ending the HIV Epidemic plan, those are being implemented in communities all over the country. Find out when they're having those listening sessions, find out when they're having those conversations, and then also go back to good old social media and see who's doing the work on the ground in your community. If you're looking for funding and resources, it's a great idea to look to. There's a lot of there are national organizations that are doing funding for work related to HIV, and there may be local organizations in your community who are doing funding around that as well. But it's so important to get tied in to networks, and I know particularly to me, it's important to be tied into networks of people who are personally impacted by HIV, and to also know who's doing the work and who's doing the work well. Maybe two different things. And so who's doing the work in a way where the community feels supported and they hold the trust of the community is tremendously important. But I definitely say try to get to some of those tables, whether you have an HIV community network or if it's a public health, department convened roundtable or council. Get to those spaces and find out who's doing the work in your community.
I love that. Thank you so much. Looks like we had another question slide in. So we know that melanated women are the most disproportionately affected women in terms of HIV acquisition. These women are, okay, looks like maybe they're not, so maybe this is as maybe not by, these are not men who have sex with men necessarily. Are there any programs that you know of that prioritize, not target, cisgender, heterosexual Black men as well? So let me rephrase that a little bit. We know sometimes when we typing, things might happen, especially when you're trying to slide that question in really quickly. No, that's okay. All right, so we got a correction here. There we go. All right, so we know that melanated women are the most disproportionately affected women in terms of HIV acquisition. These women are not being affected by MSM necessarily. Are there any programs that you know of that prioritize, not target, cisgender, heterosexual Black men as well? Thank you for the question.
Thank you so much for that. This is a conversation. I was pre-COVID, was in a meeting, and a man came up to me who said, "I'm just a straight man. I'm just a plain old straight man, and I happen to be a veteran, and none of these programs are for me. I don't feel comfortable in any of these spaces." And I think that is a real issue. What so often happens is that we we focus efforts in a way, and our focus is driven by our funding. Like, let's remember that too, right? So when the numbers say, we've all got to focus on Black MSM, everybody write grants to focus on Black MSM or same gender loving men. And then that's what's out there and that's what's available. And we have to be able to do more than one thing at a time. So I really appreciate this question. So part of the problem is that certain groups, and we'll say specifically Black heterosexual cisgender men, do not see themselves in the movement. They don't see themselves as even being seen as a community that can live with HIV or become HIV positive. And so then we have this issue of this lack of understanding that it does not matter. It is not who you are or how you identify. There are particular behaviors that we can engage in that might put us at greater risk. Thus, you need to be aware of what these things are and how you can prevent that. So I don't think that I can't name a specific program that speaks to Black cisgender heterosexual men. But I do think that we need to have more programs that are inclusive in the narratives that we tell, the images that we utilize, the stories that we uplift have to be more inclusive of the full range of our community. So I think that has to be part of our work and our commitment moving forward, is that people have to see themselves in these conversations. And there are ways that we can do that. I think that organizations who are providing, I think funders have to be accountable around that, right? Like, there has to be accountability about providing services to the Black community and not being so narrowed in a way where we're excluding certain communities, because we also realize that disinformation is self-reported. And so there may or may not be some accuracy as far as what behaviors people may be engaging with, or who people are choosing to have sex with, may or may not even be always accurately captured. And I don't believe I don't use the term DL. I don't think that's I don't think that that's the appropriate way for us to address and discuss these issues. But there are folks engaging in sexual behavior where there's not honesty happening around folks' sexual histories. And so we also need to empower people to be able to make decisions about their own autonomy, and feel empowered to make those decisions as well. Because part of it is also in our community being made to feel like men are supposed to hold some authority around sexuality, or supposed to have some control over how things happen. So it is so critical for us to provide education across the board to everyone. And that should start in schools. We were talking about the lack of comprehensive sexual health education. So that should be happening much earlier than it is. It's very hard to unteach the way that folks are learning about sex from their peers, misinformation, and about how they may be exposed to certain things or feel that they can't be because of that misinformation. So we really need to be fighting for comprehensive sexual health education, and also for funding of programs that really focus on the needs of the Black community at large. Absolutely.
Thank you so much. And the viewer also commented this is why we have to help them with that with via our programs. And we also had a chat comment that says there are some private and public groups on social media that are creating space for straight men of color who are living with HIV.
Wonderful.
Thank you all for these really great questions and this really rich conversation. So we've got about 3 minutes left to go. So if someone has a pressing question, feel free to ask. Otherwise, we'll go ahead and wrap things up. I'm so appreciative to Daphina Ward. I have to practice because I have a country accent, right? And so my country accent does not let me pronounce people's names correctly sometimes. But I think I got it just now.
You're
All
good.
right. So
No problem.
I'll make my grandpa proud, right? So thank you so much for taking the time to be able to talk with all of us. Thank you to all of you who have tuned in live during Zoom, and for everybody who will tune in via social media later. Like I said, in about a week or so, you should be able to catch this on our YouTube channel at Black AIDS. If you'd like more information, feel free to reach out to me via my email. It should also be in all of your Zoom links, but for those who are watching, all of your Zoom emails, excuse me, but for those who are watching later, it's TanishaL@blackaids.org. You can also find me on the blackaids.org website under the staff page. Once again, thank you so much, Daphina. We're so glad that you could come out and join us. Please be sure, everyone, to check us out every fourth Thursday for these webinars. I believe we have 2 more left for this year. We're coming to you at 11 a.m. Pacific, which is 1 p.m. Central and 2 p.m. Eastern. You can stay updated on events like these by following BAI on Facebook, Instagram, and Twitter at Black AIDS. Please be sure to also connect with the Southern AIDS Coalition on their channels as well. Also, you can subscribe for email updates on our website, blackaids.org. So once again, my name is Tanisha Lewis, Senior Manager of Training Capacity Building at the Black AIDS Institute. I'm wishing everyone a wonderful end to your week. Please be safe and please be well. Thank you so much.